If you are a senior citizen on Medicare or you are getting ready to sign up for Medicare, I have breaking news. Starting January 1st, 2026, Medicare is going to start using AI to approve certain benefits. So doctors will have to submit their request for approval through AI for certain treatments, procedures, surgery, equipment needs that seniors need that doctors have prescribed now have to go through AI for approval. This is fresh off the press, reported by the New York Times today, that Medicare will require prior approval for certain procedures. This is unprecedented. This has never happened before. Traditional Medicare has always been where seniors who do not want any disruptions, seniors who do not want any delay with their benefits, seniors who want to be able to get the procedures, surgery, treatments, equipment that they need without any bureaucracy, go for benefits. So if you are on traditional Medicare right now, this is big news because now AI is going to be in the middle between you and your doctor, and is going to be able to deny benefits if it doesn't think that the benefits or the request from your doctor is necessary. Guys, this is unprecedented. It has never been done before with traditional Medicare. I am going to bring you the details from this breaking news from the New York Times that Medicare will require prior approval for certain procedures. So, my name is Kwame Kwade. I am a government benefits expert. I've been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and other personal finance issues that affect seniors. If you're new here, welcome. I am glad you're here. Hit the like button, hit the subscribe button, and do me a favor. If you have never watched my channel before, let me know your city and your state. And if you've been watching my channel for a while, welcome back. I am glad that you're here. Now, let's talk about this breaking news because this is going to change Medicare forever. So, in case you're not really sure how this works, traditional Medicare has always been the place that seniors go if they don't want to deal with the bureaucracy because other Medicare plans require prior approval, especially Medicare Advantage plans. There are certain procedures that your doctor has to get prior approval before you can get treatment. But what is happening now is that traditional Medicare is now going to go that same direction. And this is an initiative by the Trump administration. It is called the Wasteful, Inappropriate Service Reduction Model. It will start as an experiment in 6 states, and then it will be expanded across the country. So, why are they doing this? Why is pre authorization necessary? Well, pre authorization is when an insurance company requires doctors to get permission before providing certain treatments. It can cause delays in accessing needed medical care. The process has been heavily criticized in Medicare Advantage plans for denying or delaying care, for sometimes leaving seniors without critical procedures that their doctors have recommended. And so here we are. Now that is going to start with Medicare Advantage plans. Now, what specific states are going to be affected? Well, in January 2026, it's going to start with the following states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington State. These states are going to be part of this pilot. And let me tell you what's going to happen. Once they are able to start in January and go a few months in these states, I am positive Congress is going to pass legislation to expand this pilot to all 50 states. Because guess what? People in these 6 states are going to be complaining. Seniors who are going to be subjected to this requirements where AI is going to be approving procedures, surgery, treatments, equipment that your doctor say you need as part of your treatment, that now AI is going to stand in the middle of you and your doctor to determine whether it's actually necessary. And don't take my word for it. Let me read the New York Times so that you can hear what they are reporting and where this is coming from. So let's get to it. It says Medicare will require prior approval for certain procedures. A pilot program in 6 states will use a tactics employed by private insurers that has been heavily criticized for delaying and denying Medicare medical care. Let me know in the comments right now. I want you to react to this. Why do you think they're doing this? And is this something that you think is a good idea? They say they're doing it to eliminate fraud and waste. But there is something they are not telling you, and I'm going to tell you in a second. But let me read the New York Times story and let you know they're using an example from somebody that got traditional Medicare and now is afraid that their Medicare is in jeopardy. So it says, like millions of older adults, Frances Ayers faced a choice when picking health insurance: pay more for traditional Medicare or opt for a plan offered by a private insurer and risk drawn out fights over coverage. Private insurance often require cumbersome review processes that frequently result in the denial or delay of essential treatment that are readily covered by traditional Medicare. That is the sentence I want you to think about. Private insurance often require cumbersome review process that frequently result in denial or delay of essential treatments that are required, that are readily covered by traditional Medicare. This practice is known as prior authorization and has drawn public scrutiny which intensified after the murder of United Healthcare executive last December. So this particular issue has been a problem because healthcare companies have been using it in traditional programs, but it was never in Medicare, specifically traditional Medicare. And now here we are. So Miss Ayers, a 74-year-old retired accounting professor, said she wanted to avoid the hassle that has been associated with such practices under Medicare Advantage, which are private plans financed by the US government. Now she is concerned she will face the same denials anyway. Why? Because the rules are being changed. And here's what's happening. The Center for Medicare and Medicaid Services plans to begin a pilot program that will involve a similar review process for traditional Medicare. So that was what I was trying to get at, is that they are changing the rules. Traditional Medicare used to be very safe. Seniors who wanted to pay a little bit more but get a peace of mind got their benefits that way. And now you are going to have to go through AI to get your benefits approved. But here's what they are not telling you. So who is going to do the approval? Well, Medicare will hire private companies that will use artificial intelligence to screen medical requests. The idea is to reduce costs by filtering out unnecessary or overly expensive procedures. So if the procedure is expensive or if they consider it unnecessary, they're going to reject it. Now think about that. We live in a country where healthcare costs have been going up astronomically. And so why is it your fault that healthcare costs are so high, but you have insurance through the government, through Medicare that you've paid into your whole life, and now you need the procedure, you need the surgery, you need the treatment, you need the equipment, and now they're telling you it's unnecessary because AI said so, or they're telling you that it is expensive and they cannot cover it. So the companies that are being hired to do this will be paid based on how much money they saved the government. Now, there's a big problem with that. When you are incentivizing people based on how much money they are saving you by denying claims, then it's going to make them more likely to deny claims. So that creates a strong motivation to deny to deny claims for seniors even when care may be needed. So picture a scenario where your doctors are going to request specific services, and then the AI is going to say, no, that is not necessary, or that is too expensive. So here it is. It says the government plans to hire private companies to use artificial intelligence to determine whether patients will be covered for some procedures. Think about that. Now we're going to rely on AI to decide whether you get your surgery or not. Now, AI companies selected to oversee the program will have a strong financial incentive to deny claims. Medicare plans to pay them a share of the savings generated from rejections. Think about that. That sentence alone, let me highlight it for you guys. This is crazy. So here's a sentence right here. It says, let me know what you think in the comments. This is some serious stuff. So let's talk about it in the comments. It says the AI companies selected to oversee the program would have a strong financial incentive to deny claims. Medicare plans to pay them a share of the savings generated from these rejections. So you're going to hire a company to use AI to screen Medicare requests from doctors that have requested procedures, surgery, treatments, equipment that seniors need. And then you're paying this company a portion of what you save from things they have rejected. What do you think is going to happen? They're going to reject more claims so that they can put more money in their pocket. It is as simple as that. And so this is very disturbing because now we are going to put a lot of seniors at risk. A lot of seniors are going to suffer because necessary medical procedures, surgery, treatments, equipment, and other medical help they need would now be put into a private company's hand with AI that is incentivized to reject more claims because they get a cut of the savings. I'm trying to find a parallel here. I'm trying to find a parallel about this. Say that um, let's say that you apply, you apply for, let's say the government spends a certain amount of money on disability benefits, okay? And then they hire a private company with AI and give them all disability applications and say, hey, I am going to pay you a certain amount of money, and then I'm going to pay you a percentage of the disability claims that you reject. What do you think the company is going to do? They're going to reject more disability applications because they know that the more they reject, the more money they get. That is what's happening here. The company is being hired to and incentivized to deny a lot of claims because their compensation is tied to how many claims they reject. That is not me saying anything. That is directly from this breaking news article from the New York Times. It says the government said the AI screening tool will be focused narrowly about a dozen procedures, but if you hear some of the procedures you're talking about, one of them is pain management. Do you know how many seniors have to get pain management, back surgery, and all these things because they need it? And so for the government to say that pain treatment is one of them is really, really disingenuous and also affects a lot of seniors. The program may add or subtract a list of treatments it has slated to review depending on which treatment it finds are being overused. But while experts agree that there's wasteful spending, they worry that the pilot program may pave the way for traditional Medicare to adopt some of the most unpopular practices of private insurers. So, in my opinion, I think this is just a way to open the door to allow more private companies into Medicare, traditional Medicare, and eventually have it take over traditional Medicare. Why do I think that is the case? Well, let me show you a graph. Let me show you a graph that will tell you why I believe that this is just the opening the opening scene of something bigger that they're trying to do here. So if you want to see how many people are on Medicare Advantage, look at this. So since 2010, Medicare Advantage share of total Medicare enrollment continues to grow all the way. So by 2026 is going to be 58%, almost 60%. But look at 2010, it was 25%. So slowly, the percentage of people on traditional Medicare continues to shrink, and the percentage of people on Medicare Advantage plans continue to grow. And so Medicare Advantage is now the majority of people are on Medicare Advantage. And now the other people that are on traditional Medicare are now going to face these same rules that traditional Advantage Medicare uses. And very soon, the government is going to say, well, it's all the same. There's no difference between traditional Medicare and Medicare Advantage. So why don't we make everybody get Medicare Advantage? And then the private companies would have won and gotten all of Medicare into private hands. I think that's where this is going. And if you don't think so, let me know in the comment section below, because I believe that that is the game that is about to be played. And if seniors do not rise up and make their voices heard, Medicare is never going to be the same. I mean, remember, they're going to do it in 6 states. And those 6 states that they are going to be piloting is New Jersey. Where do I have my list? Okay, here we go. New Jersey, Arizona, Ohio, Oklahoma, Texas, and Washington State. So these are the states that are going to receive the pilot of the new, what they call, wasteful and inappropriate service reduction plan. That is what we are calling it. But in my mind, it is a way to deny seniors critical care that they need. So why is this happening? Well, officials say Medicare wastes billions each year on treatments that many may not benefit from. This program is designed to stop paying for those unnecessary services. Some procedures have been flagged as questionable, and Medicare's hopes to provide approval will stop these financial abuses. And then they want to save money. Medicare estimates several billions dollars could be saved for over 6 years. These savings are projected to help preserve Medicare's financial stability. Now, what do seniors think? Well, seniors are worried about loss of choice. Many people purposely choose traditional Medicare to avoid these approval hassles. Now they may face the same barriers they tried to avoid. And then you have denial fears. Seniors worry their procedures might be blocked to save money. So seniors are worried that their procedures might be blocked to save money. Even if appeals are successful, most patients never appeal due to stress and time. And then it's a slippery slope. Experts warn that this pilot could slowly expand to more procedures. I mean, it's just like clockwork. Once they get to do something, they are not going to stop there. They're going to do more of it. They're going to expand it and try to cover even more services. And very soon, everybody on Medicare, traditional Medicare, will have to get approval for almost anything that involves a little bit of money. Doctors don't like it. They've been pushing back that this is just a burden, and seniors also don't like it. Seniors have been making their voices heard, and they don't like it. So why is the government doing it? Is because they can do it. And number two, I think it's a way to begin the process to privatize Medicare, traditional Medicare, and have it go the way of Medicare Advantage. And as I shared with you, This graph tells you what is projected for the percentage of Medicare Advantage plans by 2030. So as you can see, it is the largest chunk and it will continue to grow. So let me know what you think in the comments. Now, if you are worried about all of this and you're not sure about your Medicare plan, well, there is help. Our partner, Chapter Medicare, whose number you see on the screen, is on standby to help you figure out your Medicare plan. If you're 65 and receiving Medicare or about to turn 65, Chapter can help you get you into the right Medicare plan. You may not know this, but 90% of all seniors are in the wrong Medicare plan because they don't know the entire process that it takes to be able to get into the right plans for you. And so Chapter has access to all 24,000 Medicare plans and can help you like they've helped over 2,000 of our viewers get into the right Medicare plan. 2,000 of you have already called them and gotten help. You can be the next. Call 539-205-2147 or go to axchapter.org/insider. I'm going to put their link in the comments and in the description, and they can save you over $1,100 a year. These are the people you're going to be talking to when you call them today. They are on standby to talk to you and help you out. These guys are A+ rated with the Better Business Bureau, 5-star reviews all over the place that I have even shared with some of you on previous lives. So call Chapter today. They will help get you into the right Medicare plan. If you have any comments or questions, let me know in the comments. If you like what you heard, hit the like button, hit the subscribe button, and I'll see you all tomorrow.